Guys, welcome back to my channel. My name is Ruth. If you are new to this channel, welcome. In today's video, we are going to be discussing about the pros and cons of being a CNA while in nursing school. And should you become a CNA while in nursing school? So first of all, I must say that there are more pros than cons to becoming a CNA while in nursing school. I'm going to start with the cons. So for the most part, the con that I see when it comes, or the downside of becoming a CNA while in nursing school, is that you're going to be tired a lot. And if you're someone who cannot balance multiple things at the same time, it's going to be challenging for you to balance your study time and the time you spend at work. But there's also a way you can handle that. You can actually limit how much time you work if you just want to get the experience of working as a CNA in the hospital or maybe in another setting. But I'm going to be focusing in this video on the hospital setting because that's what I'm familiar with. So that is the con of it, that you're going to be tired a lot, and it requires time management and determination to be able to do it, to work while going to nursing school. So some things you can do are like maybe working once a week, being like a PRN, also called as needed. It's an option to you. You can work as a PRN where you choose your day that you want to work in a week, the day that is most flexible for you, to enable you to still have that experience and to also successfully meet your goal of completing your nursing school program. So enough said about the cons. Let's get into the pros. So I have a little note so that I don't leave anything out for you guys, okay? So your first pro is that you'll be able to learn how to interact with patients at the bedside before becoming a nurse. I say this because when I first started working as a CNA, you would think just walking to a patient room is something simple and say hello to them or whatever and greet the patient. It's easy. It is nerve-wracking if it is your first time in a hospital setting or if it is your first time doing this type of job. And for me, it was my first hospital job, like one-on-one patient care. So it was challenging for me because some patients will be me. Some patients, you go into their room, they have their families and they are talking, and you don't know how to really get into that conversation and say what you want to say. Sometimes you think you don't want to be rude, but you also need to do your job and be able to get out and still be respectful of them. So that's something you're going to learn over time, how to get into those situations and still make your patient feel at ease and still make them want to have you there, like welcoming you in. How do you approach them when you go in? So those kind of things you learn as a CNA. Once you become a nurse and you already have that down, you don't have to worry about that anymore. You already have that patient interaction under your belt. It's a plus for you. And the second pro of being a CNA while in nursing school is that you get to work with nurses. And that is what you want to be anyway at the end of the day. So getting to see how they work, how they carry on their activities, how they interact with patients, how they administer medication. You get to have this opportunity to watch them while you are a CNA. You spend more time with the patient. You bathe them, you clothe them, you sometimes feed them. There are some patients who cannot feed themselves. So you spend those time with the patient So when a nurse comes in to carry out her tasks, you get to see what they're doing and learn. And it helps to make some of the things you are learning in school make more sense to you. Another advantage or pro for being a tech while in nursing school is that it teaches you how to time manage. Yes, time management is a very important thing in the nursing field. Especially when I was a tech, I had a lot of patients. Starting on when I was shadowing or being precepted by other techs, we work together. But when you're on your own, the least patients I ever had were maybe 9 patients. But sometimes if there is shortage of techs or CNAs, you're going to be like the only tech on the floor. Even if you get told that the nurse is going to help, honey, it's not all that buttery. Because guess what? If that nurse needs to change that patient that is to assist or needs more assistance, who is she going to call? Is she going to call her fellow nurse? No, honey. She's going to call you to come and help turn the patient. And guess what? You be the one who ends up changing that patient again. So, yeah, that's the reality. But if you have time management skills, you would plan your activities in a way that even as you go in first to do your VADAs, and I'm going to make another video on how to manage your time as a tech and everything, because I was a tech for over a year and I became a very good tech, I must say. So I'm going to make a video to help anyone who wants to be a CNA or a tech on how to manage their time and how to work effectively. But just saying, if you're going to do your VADAs, you will know what to take with you. You may use it, you may not use it, but at least you have those tools with you. So in case, say you want to do your VADAs, sometimes there's no temperature probe inserter in there. You walk in, maybe it's a COVID room or a contact for some other reason room. You go in, check the blood pressure, time to check the temperature. There is no probe to be used. You have to undress, go out and get another. That's waste of your time. So being a tech in a hospital while in nursing school teaches you all of those skills. How to manage your time wisely so that you don't spend so much time than necessary with one patient and then the rest of the other patients don't get the care that they deserve. All of those things you get to learn. So time management is one of a plus that you get to learn as a CNA while in nursing school. Even though there are slight tweaking and different things that nurses do that you still have to learn, that I, as a new nurse, I'm still learning how to time manage on those things. But for the most part, at least it puts you in the mindset of managing your time. Next pro on this list is it helps you to know what your CNAs are doing. So when you become a nurse, you're not going to be blind to what your tech is doing. And sometimes the patient, you might go in this patient room and the patient needs something that you need to assist them with. Maybe changing them. And they are not like to assist where you need more than one person. If you have already been a tech, you love your job, like me, I won't have to go unless I have other things to do. Maybe I will call, hey, hit the call light and say, hey, so and so, can you come in and help do so and so thing for this patient? I would, because that's the same balancing my time management. But if I know I have some time on my hand, I won't have to call or tech to do it. I will just change that patient right there. I'm not afraid of getting my hands dirty because it's something I have done before. So I get to still provide care for my patient and still do my nursing job, depending on the situation. So it helps you know what to do. It helps you to be able to sometimes help your techs too. You can beat that. Okay? So yeah, those are some of the pros of being a CNA while in nursing school. Because I've seen some like nurses who have just come out of nursing school without any CNA or tech experience in the hospital. It is very challenging for them. Like they don't know what they're doing, like when it comes to those kind of things. And honestly, I felt the same way when I was in nursing school before I started my CNA job. As a CNA, I wasn't even starting as a nurse, and I had no clue. You would think like, oh, it's just changing someone, oh, it's just this. There are ways to do it, honey. Because guess what? My first time changing a patient with my, and I was still being trained in. I saw this girl that was precepting me, changing her patient with C. diff, a very contagious disease that can be spread through contact if you touch the patient's species. And that girl changed that patient, and it did not even touch the bed, nor the layer of linen under the patient. Like, she was a pro. And I was like, when will I ever become like her? I'm telling you. So at some point I became like her, and even maybe even better than her, honestly. So it's a skill you need to learn. That's why they call them certified nursing assistant. They get trained for it. It's not as some people make it look like. You need to get trained to do it. I did not go to a CNA school, but I will tell you how I got to get into this field as a tech in a hospital in another video. So the next thing that I know being a CNA will do for you, the pro of being a CNA, is that it humbles you. Yes. Because I will hear some people, like even some nurses, honestly, I'll put this. I'm a nurse now, so I'm not going to sugarcoat anything so much to protect us. I know I still will be, but honestly, some nurses look down upon CNAs. Some nurses think that CNAs are nothing. And I feel like most of those who do that are people who maybe were never CNAs before, or maybe even if they were CNAs, they hated that job as a CNA. So if you work as a CNA and think that it's disgusting, is this, is that, if you see someone else working in that role, you will think of them that way. But honestly, I work as a CNA and I did not think any less of myself. I did not. Even if you wanted to make me make me feel that I am less of a person, I never allowed that, because I knew that number one, this is temporary. I was in school to become a nurse like you in the first place. Even if I was doing CNA forever, it is an honorable job. Caring for people who cannot do something for themselves, helping them out. I feel it's one of the best things anyone in life can do, to help someone else in need. So for any nurse out there who thinks CNAs are nothing, saying, oh, they're just cleaning. Like I've heard some people say, oh, they're only there to clean shit. That's not the only job CNAs do. CNAs are very important. I can tell you that CNAs are very important. When I was a CNA, there are many times where I caught codes where patient, if I had not stepped into that room, that patient would not have survived. And there are many situations other CNAs can attest to. The nurses are busy. They have things going. They have families to speak to. They have doctors to speak to. They have medications to pass. They don't have that much time to spend with the patient. CNAs answer most of the call lights. At least as a CNA, as a tech, I answer a lot of the call lights. CNA do more rounds than some nurses, I must say. So being a CNA humbles you. It makes you to respect other CNAs in the future when you become a nurse. And it makes you to know that no job is too small for you to do. That's the honest truth. So that is it about it humbling you. I can go ahead and talk more about it, but a lot of things that are caught. Even nurses rely on CNA for a lot of vital information. I know nurses will check their vitals and stuff like before they pass meds and stuff. But after they done passing meds, do they have time to always check their midnight vitals that the techs have collected? No. If that patient is sparking temperature, if you rude to a tech or a CNA, that tech can sit and watch. If she's not a God-fearing person, watch that temperature 104 point whatever, 105, and just chart it and leave. It is your responsibility to check those vitals. But if you have a good rapport with your CNAs, if they see something that's not going on right, they will come to you and tell you, oh, Mr. So-so-and-so is behaving so-so-so way. He wasn't looking like that. Or Mr. So-and-so, temperature is so-so-and-so. Yes, so that's the kind of relationship you want to have with your CNAs. So I'm just saying this, if you're a nurse that you think you're better than a CNA, that's not the video for it, but I'm telling you, you need to stop. Okay? CNAs are very important. Very, very important to the healthcare system. And last but not the least, being a CNA, what it does for you, the pro is that it gives you an experience. I can tell you no lie. Like, in the future, when you're done with your program and you're applying for a job, having on your resume that you have been a CNA or a tech in a hospital setting especially gives you an edge. You don't need any kind of reference. Like me, I did not have any kind of connection in the hospital. I did not have an uncle or auntie or in-law or whoever in the healthcare system to put in word for me. God was my word. In my little experience as a CNA, I know that having a CNA experience on my resume really play a lot of part in all the offers that I did receive and finally decided to go with my job that I currently have. So the hospitals are looking for people who have hands-on experience and will be able to care for their patients who they don't have to teach how to do. Like, it saves them money if they don't have to spend time teaching you how to do basic things as a nurse. So yeah, if you have anything else you think that's being a CNA affected you positively or negatively while you're in nursing school, leave it down in the comment section and we can talk about it, okay? But for now, I'm going to end this video right here. And I thank you so much for all my viewers and subscribers. Thanks so much for your support. I really appreciate you guys. We are growing little by little and we are going to work on making more contents. And if you have something you want me to talk about, leave it down in the comment section as well. And I'm going to make videos on it. Okay, you guys have a great day. Bye-bye.